Hello everyone, welcome back to my channel. So for today's topic, I wanted to talk about the pros and cons about working in aesthetic nursing. And for those of you who don't know, I did work in aesthetic nursing for like four and a half years, and I went back to the hospital. I'm currently a labor and delivery nurse. And a lot of you may be wondering why did I go back to the hospital nursing? And like with everything, like this video, every job has its pros and cons. And that's like that saying, you just kind of have to pick your poison. And then also, like scheduling wise, some things work better, or there's like a better fit with like different jobs. So, like, we'll talk more about that. Okay, so we'll start off with the cons first and then end on a happy note with the pros. With my first con being that your patients are going to be picky. Now, it comes with the job. Like, of course, every patient has the right to be picky because you're dealing with their face. They want to know that they're in good hands, that you're not going to like mess up their face. Yes, that's normal. But I'm talking about that little small percentage that who have the unrealistic expectations. Like, no matter how much you educated the patient on what a certain product can do, what they can do specifically for that patient's like skin quality, texture, and all that, they still get mad at you for not for not doing a miracle work and not achieving the result that they wanted, even though you already educated them. Like I said, it's not a lot, but there's like a small percentage, and like, yeah, you will have those. The next one being sales. So like, I feel like it comes with the job. If you work in a hospital, you don't even have to deal with sales. You just do your job and then that's it. With aesthetic nursing, there is some degree of sales in the job. I worked at different places where when I didn't have to be responsible for sales, it was somebody else. But at my other job, I had to be responsible for sales. And I've seen situations where if you don't meet your goal for the month, then you end up getting let go. Like, it's rough. And like, if you're into sales, like if you're like good with like upselling people, then it might not be a con. But like, if you're someone who's like kind of uncomfortable with like upselling products to people, then it can be kind of a con. And then the next one would be scheduling. Like, not scheduling, but I guess like the hours, because if you work in a hospital, you work your 312s and then that's it. In the outpatient setting and aesthetic nursing, I've seen 8-hour shifts and 10-hour shifts. The 8 hours being like 8 to 4, 10 to 6, 12 to 8. If you're working 10 hours, it can be like 8 to 6 or 10 to 8. So depending on which schedule, it can be nice. Like, if you work later in the day, then you can have your mornings to do your school drop-offs, go get a workout in, just have time for yourself. But you are working more days. So in the hospital, you're working 3 days a week. Outpatient, you'll be working either like 4 or 5 shifts a week. So you'll be working more days. Next one is that it is going to be difficult to get in. I've already told my story. I'll leave it linked down below, but on how I got in, because I was able to get into the aesthetic field with no experience. Because if you look at a lot of postings, they require like a year or 2 experience, and you're like, well, how am I going to get experience if no one is hiring with no experience? So it's a kind of a hard industry to kind of like break into. And the next one would be calling out. So if you call out in the hospital, they can rearrange the census where like they move the patients into like a different floor. That way they can accommodate, or they can call in from the float pool, or you're just going to be short staffed and you have more patients. So like, they'll make it work in the hospital. But when it comes to like aesthetic nursing, if you call out and if there's no one to cover you, then all those patients who were going to see you for that day or however many days you call out for, they're going to have to get rescheduled. And sometimes, obviously they get mad at you, but it's just not a good feeling, Sometimes I do have like a pool of like nurses who can help out if you call out, but other locations or different Med spas, they don't have that. So if you call out, then they're just going to have to reschedule the patients. And I'm sure you've experienced that in the past, where if you go to your doctor's office, a dentist's office, they call you early in the morning and say, hi, I'm sorry, your provider called out for today, yada, yada, yada. We're going to have to reschedule you. And it can be disappointing. So that kind of sucks. Okay, so moving on to the pros is that obviously working in aesthetic nursing, it's going to be less stressful than working at the bedside. Now, with every job, it's going to have its stressors, but in the hospital, you're trying to keep someone alive and not you lose your license. In aesthetic nursing, at least one of my concerns was like not messing someone's face, not just like causing a vascular occlusion when it comes to fillers, or doing hyperpigmentation if you're dealing with lasers, not burning their skin. So like, yes, there's stressors, but it's like less stressful than being in the hospital. If you're working with lasers, you really have to know your settings, because if not, you can make their condition worse. Like if they're coming in for a dark spot, you can actually make it worse and make it even more dark, and then it's irreversible. And yeah, so you have to know what you're doing. And as far as like fillers go, there's some products that can cause vascular occlusion. So some are reversible, some are not. So that is scary. So the next one is going to be, you're no longer working major holidays. You're not going to be working nights anymore. You're going to be like a regular person and wake up when everyone wakes up and then go to bed when everyone goes to sleep. So it's very nice. So usually most major holidays, so like Christmas, Thanksgiving, New Year's, the clinics are going to be closed. You don't have to request those days off. It's just you're going to have those days off. And it's so nice because you get to be with your family and you don't have to like stress about finding coverage because the clinic is just closed. It's nice. And then you don't have to deal with working night shift anymore because the clinics work on a regular day hours. So that's nice. And next up, and this is one that I miss so much, is obviously the perks of working in aesthetic nursing. There's a lot of things that you can get for free or a really high discount for being an employee. And I miss this so much because the products, procedures, and all of that, it does cost a lot of money. I'm not gonna lie, it does cost a lot. And if I were to purchase all the things that I've gotten done to myself out of my pocket, I don't know if I would have, because it's a lot. The perks is definitely nice. A lot of times when we had trainings, when we had new hires, the staff would be the first ones to volunteer themselves to be the guinea pig or like the model, and essentially you would get it for free. So it's so nice. Okay, the last pro / con. So the last one is pay, but this can be a pro or a con. It just depends on where you work, and I've worked at both of these situations where the pay structure is just a little bit different. So the first one being is that you get your base pay and then that's it. And typically if you're working outpatient, it is going to be less than working inpatient. So you just get that. Maybe you'll get a monthly bonus, but for the most part, you get your base pay and then that's it. Versus maybe another med spa, you'll get your base pay, you'll get commission, you get tips, and then you get your monthly bonus. So that all adds up. But every pay it'll fluctuate a little bit. Some months will be better, some months will be a little bit lower. And we have like the high seasons and the low seasons. Like when it's like back to school season, a lot of people don't want to buy stuff for themselves because they're saving it for their kids. So like there's like things like that. So if you're wanting to have something like consistent as far as like pay, that's something to consider because it's gonna fluctuate. Once you have your clientele, like all the patients who come see you regularly, it might be like a steady income, but as far as like even at different locations, like even the tips, it'll be different because I've worked in different cities, like the same med spa, but like in different cities, where some population they're more willing to tip, and then others they don't really tip that much. So that's just something to consider as far as like if you're thinking about your pay. And then yeah, those were my pros and cons in working in aesthetics. If you have any other questions in aesthetic nursing, just leave them in the comments below and I'll try to answer them. And I will also link the video where I talk about how I got into the aesthetic field if you want to learn more. But yeah, I will see you guys in my next video. Thank you for watching. Bye!